Welcome to Emir Society of Ophthalmology Conference ISO 2025. Welcome to AE. Welcome to Abu Dhabi. Dear Dr. Fouad Sayyad.
Thank you.
As I know, you are a consultant, ophthalmologist, cornea, cataract, and refractive surgeon.
Correct.
And you have and you are American board certified. This is very impressive, actually. First of all, I want to ask you, how did you like the conference so far?
So far the conference has been great. This is actually my second time attending the ISO. I came 2 years ago, so I'm excited to be back. I have 3 talks. I gave one yesterday about PRK haze, and tomorrow I'll be giving 2 other talks, one about corneal graft failure and how to diagnose it and manage it, and the other one will be about endothelial keratoplasty, the past and the future. And both are 10-minute talks, which I'll be giving tomorrow afternoon.
It's interesting. Do you distinguish between the graft failure and the graft rejection?
Yes, of course. Graft rejection is actually one of the most common causes, the most common cause of graft failure. So it's very important to diagnose it early. And I'll be discussing and showing some interesting cases of how graft rejection, if diagnosed early, you could actually save the graft and prevent it from reaching total graft failure. Whether it's endothelial graft rejection or like a PKP rejection, stromal or epithelial.
I want to ask you about your American board. Tell us about the journey until you got it, because it's rare actually.
So
I find young doctors like you have an American board.
So I graduated from Cairo University 2010, and I was actually born in the U.S. And I decided that I wanted to pursue a career there. So I had done some electives abroad, and I had applied for a research fellowship in Bascom Palmer, Miami, which is one of the top hospitals there. And I got accepted right after I finished my internship. So I'd actually did 3 years of research fellowship, because ophthalmology, as you know, is very competitive. It's not impossible as most people think. It is competitive. They take only 4 to 6% of their residents are international medical graduates. So I had to do a lot of research. I worked with great mentors in glaucoma for 1.5 years, and then cornea. And I think they were the most important aspect. I did a lot of research with them, papers, and it was very eye-opening experience for these 3 years. And I'm very grateful that I got the chance. Then I applied for the match for the residency in late 2012, and I got accepted. 2013, I did a 4-year residency at University of Florida in Gainesville. So I stayed in Florida. It was which is right next to Orlando. And after finishing my residency, I decided to pursue cornea. So I did a fellowship. I applied for the San Francisco match, and I matched at University of Washington, in St. Louis, Missouri. And I spent there 1 year. And after your fellowship and residency, you're eligible to take the American board, which is a written exam. And then after you pass that one, I passed that, alhamdulillah, and during my fellowship, a few months later, you take the oral exams. And once you pass both these, you get the American board.
This is impressive.
So it was in 2018 when I got it.
But you leave Egypt.
I live in Egypt, correct.
You leave. I mean, you left Egypt to USA.
Yes, in 2010.
To be an ophthalmologist, or because it's not guaranteed that time, right?
Well,
when you start your journey.
Of course, it wasn't. I actually, during my second year, I had some backup that it's very competitive. I saw a lot of people who didn't match, but the few that did match told me just persist, stay. The problem is the majority of people who say it's difficult, they don't actually try. But I know at least 10 of my colleagues who went through the path. They did a lot of research. They persisted, and persistence is key. And most of them matched.
This is excellent. I think I want to ask you, about what's your advice for international doctors who considering training at the US?
I think now, a lot of people are considering it. Of course, the exams have become easier because they're only pass or fail. There's the USMLE Step 1, Step 2. They even canceled the CK Clinical Knowledge, which was at my time one of the most difficult ones. They just need you to be good at English proficiency. If you have decided to pursue that path, you just need to be dedicated and continue till the end. The main issue, of course, is finding a research position. It's difficult to just apply from Egypt and think, oh, I'm just going to apply for the match and that you'll get a position. Whether it's medicine or ophthalmology, even medicine has become competitive. You need to spend at least a year doing a clinical attachment, doing some research, show the people who will see you, make sure they don't really want like someone who's just gets the best scores. Actually, they just want someone who's hardworking, ethical, is able to treat their patients respectfully, talk to them respectfully, not have an attitude problem. And if also you show that you're above and beyond and do well at research and publications, they will consider you. And a large percentage of the U.S. needs foreign medical grads, actually, especially in medicine, hospitalists, ophthalmology, at least 10 to 20 every year foreign medical grads match. So it's not impossible, as most people think, but it's just a longer path.
So 10 to 12 non-American.
From 500 to 600. So
They will take out from 500 to 600, 10 or 12?
yes. It's the lowest was 6 over the past 5 years.
Impossible, yeah.
Exactly. It's hard, definitely, but not impossible. Like I said,
So,
most of the people who've done at least 2 or 3 years of research and they don't have any issues, they usually match.
So if we go away from ophthalmology, شو رأيك أسألك بالعربي كم سؤال؟
of course.
أي كم مرة صرت زاير دبي وأبو ظبي؟
أنا زرت دبي كتير قبل كده. أبو ظبي كانت أول مرة لما جيت الإيزو من 2 صراحة انبسطت جدا. وجيت مرة من 2 شهر عشان عندي 2 من قرايبي عايشين هنا دلوقتي وشغل، فجيت زرتهم من شهر برضو. لا مختلف عن دبي، أهدى شوية، بيس فيها مختلف.
That's right.
ومور فاميلي فريندلي يعني. انبسطت فيها إن شاء الله. ما جبتش عيلتي أبو ظبي، جبتهم دبي. إن شاء الله بجيبهم مرة تانية
إن شاء الله إن شاء الله. وخبرني كيف توازن بين I think هلا أنت you are very busy at your clinic.
مصر طبعا أنت لازم تشتغل جامد عشان to make a good living يعني. فطبعا إنك تلاقي ال work life balance زي أمريكا بيبقى صعب. إحنا لازم هنا نشتغل على الأقل يوم في الويك إند. أنا كنت راجع من أمريكا قلت لا أنا مش هشتغل جمعة وسبت ولازم أخد الويك إند أوف. طبعا بعد سنتين it was hard. patients هنا بيحبوا يجوا يوم السبت في مصر. عندنا مش زي دبي لسه جمعة والسبت الويك إند. فالسبت I have to work which is unfortunate. أنا عندي 2 ولاد 6 و4 سنين صبيان، فيعني طلعين عيني شوية، بس يعني هم بس أرجع ألعب معاهم وأشوفهم يعني. بس at least Friday ده بيبقى الفاميلي داي. ولو بحاول أنا أشتغل early. إحنا في مصر معظم الناس بتشتغل actually بالليل كلينكس كتير. دي الحاجة الوحيدة اللي أنا يعني ثبتها إن أنا لا أبتدي يومي بدري. زي أمريكا كانوا حاجات اللي اتعلمتها ابتدي as much as possible early. يعني في ناس دكتورة اللي كنت بشتغل معاها 7 الصبح بتبتدي، فأنا بحاول يعني 8 بالعافية ابتدي. ده بقى كويس قوي يعني. وحاول أخلص شغل 5 شوف الفاميلي شوية قبل ما أرجع بالليل.
طيب كيف بتقضي وقت فراغك؟ your free time, do you have any hobbies, anything other than ophthalmology to do?
وقت الكوفيد كان عندي بقى free time رهيب. و I joined actually triathlons. كنت بخش مسابقات اللي هي الثلاثي triathlon، swimming، عجل، جري. وعملت كام سباق وكملت في السبورت دي 2-3. لما الدنيا اتشغلت شوية يا دوبك كده بحاول run وسويم الصبح قبل كام يوم اروح الجيم يعني. بس I'm trying to return. بس طبعا مع الشغل وال2 kids بدل 1 بتبقى صعبة شوية.
يا سيدي دكتور فؤاد، كتير تشرفت فيك اليوم. شكرا لوقتك وشكرا I think just one more question.
Of course.
Go back to ophthalmology. Are you open to any young ophthalmologist or young still intern medical doctor who want to know some information?
Of course. I'd be happy to share my email or they can send me on social media. مفيش مشكلة.
شكرا لوقتك. شكرا جزيلا. شكرا.